Hello everyone. I wanted to do a quick video to try and show you some flexion extension issues that may occur with skull positioning and maybe some rotational positions, rotational errors that might occur, and so that we're looking at the skull and the structures that we're trying to find on our x-ray to decide those different rotational or flexion extension errors. We do some tilt too. So this is positioned in a Towne's. All right, so this is would be a Towne's view. I took the frontal bone off so we could see the foramen magnum, the dorsum sella centered in the foramen magnum here. All right, so what I'm going to do is I'm going to flex the chin. So I'm going to pull the chin downward in a flexion type of motion. And we're going to watch the dorsum sella in the foramen magnum and what happens. So as I pull the chin down in a flexion motion, we can see that dorsum sella traveling inferiorly to the foramen magnum. Then if I bring the chin up slowly, bring it back to a good position, dorsum sella in the foramen magnum, and then continue up in an upward motion, this is extension. And as you can see, that dorsum sella going higher and higher than the foramen magnum in the back. Okay, now, because we use a caudal angle on our Towne's position, and that caudal, the central ray is placed on the face, right? The central ray is AP. So that central ray is going to hit the frontal bone and project everything anteriorly on the skull in a downward motion, inferiorly. So that angulation of the tube could project anything that's anterior to the foramen magnum more inferior than the foramen magnum itself, because that's the nature of the projection of that beam. We're going to take the central ray and hit it caudal, right? Hit the patient caudal from the frontal bone and project all of these anterior structures in a downward motion, leaving what's behind the face, which is the foramen magnum and the occipital bone, leaving it there so that the occipital bone and foramen magnum will be more superior. So that means if we have excessive angulation of a Towne's position, that dorsum sella is going to keep getting projected lower and lower and lower, more inferiorly than the foramen magnum. If we have insufficient angulation, it's gonna do the same thing as what an extension type of motion would do on our x-ray. So if we don't angle enough, that dorsum sella is not going to make it inferior enough to be inside the foramen magnum.